this patient needs to find a healthcare provider who can prescribe Suboxone. First resource, findtreatment.gov to locate an opioid treatment program or a buprenorphine practitioner. That being said, we know that it can take weeks, sometimes months to get an appointment to see an actual provider. If it's urgent, the patient can go to the closest emergency department. Short-term bridge prescriptions of buprenorphine can be prescribed by emergency doctors and other providers for the treatment of opioid use disorder. And then, of course, with the COVID-19 public health emergency, actually, the federal government lifted the in-person visit requirement to get a prescription of Suboxone. This means you can see a buprenorphine provider virtually through telehealth clinics like Bicycle. It sounds like this patient was on Suboxone before and now is trying to get back onto it. And there are a variety of reasons for this. The context could be maybe the patient was on it, felt better, decided to stop taking it, but now they're kind of rethinking that choice. Maybe cravings came back, withdrawal symptoms reappeared, something. Or maybe they actually returned to using opioids, which would be considered a slip or a relapse in some recovery spaces. And sometimes financial reasons or other life circumstances force someone to stop taking their Suboxone. Now, if the patients return to using other opioids and they have some previously prescribed Suboxone available, I'd still advise them to see a healthcare provider just to make sure they can safely transition back onto the Suboxone. Sometimes it gets trickier when there are longer acting opioids like fentanyl or even methadone on board. So I do recommend getting medical guidance with this. Here at Bicycle Health, we can typically get patients in for an appointment within 48 hours. And our support staff can connect the patient to a pharmacy with buprenorphine in stock. Sometimes it's hard to even get seen in a timely manner, and sometimes it's like impossible to see a doctor, and some people decide to restart Suboxone on their own without medical guidance. And in this case, for educational purposes, I'd actually recommend them review our informational video that kind of talks about precipitated withdrawal.